Good afternoon, everybody. Thank you. We'll take a minute to let all of the attendees log on and settle in. We'll begin the webinar in just a minute. Thank you all for joining us today. So we'll take a minute and then we'll get started. Just a couple of things before we get started. If you have any questions or feedback for the Chamber in general, please send them to info@windsoresexchamber.org. And we do update our COVID-19 tab on our website, so feel free to visit that for the latest information and helpful resource links. As well, follow us on social media. We have a Twitter, Facebook, LinkedIn, and Instagram account, which we update daily. And you can find out what's happening and coming up. As well, all of our previously recorded webinars are on our YouTube channel. They can also be found on our website. This webinar will be recorded as well and will be posted by the end of the day for viewing. So we offer that, and feel free to share with your network. I think at this time, I'll hand it over to our President and CEO, Rakesh Naidu.
Hi, good afternoon, everyone. Sorry, I had a small technical glitch. It's been sorted now, so everything's good. And I hope everything is good with you, with your family, with your loved ones, with your employees, and hope everyone's keeping safe. We are getting into a very crucial phase. Economies all over the world, they're opening up. As you know, in Ontario, though the emergency measures will be in place till July the 9th, as of now, certain businesses have been allowed to open. And you've seen that in the last 2 weeks, several businesses here locally in the region have opened up. So that's a great sign. The government, all three levels, many different organizations are doing their best, to spur the economy, to ensure that, we get people, our lives are saved, people get the support they need, and the economy can be put back on track as soon as possible. So to that effect, billions of dollars has been spent, as you have noted. Almost $152 billion has been spent. That's direct spending since COVID-19 started. So in the matter of a few months, unfortunately, the deficit that the country is facing has also grown, and it's up to $260 billion. And this is only in this current fiscal year. So quite a bit of effort has gone in, quite a bit of money is being spent, and there is a lot of programs that have been announced, and some that are going to be tweaked in the very near future. The Premier mentioned about that, and do expect changes, whether it is the SERP program or whether it is the wage subsidy program or the other programs. In the days to come, the government will be tweaking those programs. The CBRN, which is the Canadian Business Resilience Network, has added a couple of programs to what exists. They have now a program where small businesses, not-for-profits, charities, they can get some guidance and advice. So if you need any guidance and advice related to taxation, related to accounting, you can call. There's a toll-free number which is on our website, and we'll make sure that we also put it on the chat. So you can call that, and it's a free advice that you'll get from the network there. They've also recently announced that they'll be giving away $10,000 to small businesses. And there are about 62 more SMEs that will be able to take advantage of that. So each of the 62 SMEs will get $10,000 each, and this is a grant. Again, if you're SME and if you're interested in $10,000 grant, please feel free to reach to the chamber or go to our website, and there's information on this on our website as well. So as I mentioned, slowly but steadily, the businesses are coming back. Business confidence is increasing, consumer confidence is increasing. And Conference Board of Canada actually took note of this. In their latest release, they mentioned that the confidence index, the consumer confidence index for the month of May has increased by 16.2% as compared to the previous month, as compared to April. So that's good. It is things that are heading in the right direction, I would say, based on this data. So there's optimism, and then there's a lot of hope in the air, but there's also a lot of concerns. And the concerns to do with food prices. We've seen that there's an increase. There's potential for food inflation to increase. It has already gone up. Personal health, of course, is a problem. Economy and the rising level of debt, personal and business debt. Those are some of the concerns that have been identified by consumers. Recently, CCC, which is the Canadian Chamber of Commerce, also did a survey, and it was more focused on the industries that are opening up, which have been allowed to open up. So many of the retailers were surveyed, and I would like to share some of the results. What came out of that survey was that about 47.7% of the retailers, so close to 48%, have lost about 30% of revenue in the first week of the crisis, first 2 weeks of the crisis, I would say. Almost 28% experienced a decrease in excess of 30%, in excess of 50%. And unfortunately, 40% of the retailers that were surveyed mentioned that if the current situation continues for the next 3 to 5 months, they won't be able to come back. So we may have the potential of losing 40% of the businesses, especially the retailers, if things don't improve, if things continue the way they are. So that's really a significant number. And in terms of layoffs, quite a few retailers, almost 50% of the retailers have laid off people, and 55% of these businesses had to reduce staff hours. So, that is what has happened. Now we're getting in the phase of reopening, and as I mentioned, it's not going to be easy. As companies look into reopening, there is the additional cost of compliance. There is also reduced business that businesses know will be something that that they have to expect. Also, availability of workforce. You would not think that would be a challenge, because you'd think that most of the people would be willing and wanting to work, but that's not the case. Almost 25% of the businesses surveyed have mentioned they have already got concerns with finding and recruiting talent. So many those that have opened up are trying to find the right people, either get their employees back or find new workforce to replace some of their workers who are not willing to come back, and it's becoming a challenge. So just keep that in mind, that those are some of the issues that you may experience as well. Anyway, so as we get back into the reopening phase, with all the issues that I mentioned and all the concerns, it is going to be extremely important that we take the right steps so that we can reopen safely. We can provide the right information, the right resources that will be needed by businesses, by employers, by employees, by clients, by suppliers, by anyone that is in the community that's doing business and is part of the business community here or the broader community. So to provide us that information, to provide us with what is happening locally in the region, and to provide us with information on a toolkit that has been developed locally to help businesses reopen, we have a fabulous panel here, which consists of the senior management of the Windsor-Essex County Health Unit, very ably led by Theresa Marentette and Dr. Wajid Ahmed. And I have to say this here that, we all have heard Theresa and Dr. Wajid Ahmed, in several of the conference calls that they host on a daily basis. They've done a phenomenal job, a fantastic job. They have been very collaborative to work with, and with their effort, their tireless effort in conjunction with the hospitals, the healthcare workers, we have been able to really manage our situation here really well, relatively speaking. Though unfortunately, we still have lost 63 precious lives. But it's been several days, thankfully, that we've not had any more lives lost, and that is to a great deal because of the good work that the Windsor-Essex County Health Unit is doing along with the other healthcare workers in the region. So we've got a lot of information that will be shared today on the toolkit, on the various checklists that is being prepared, and the Chamber has been extremely pleased and thankful to the County Health Unit for being such a good partner in development of those, and we'll be sharing more information on that soon. So with that, I would like to turn it over to Dr. Wajid Ahmed, who will be providing us an update on what's happening, and then we'll get into the toolkit right after that. So over to you, Dr. Wajid Ahmed.
Hi, good afternoon, everyone. Thank you for joining this session. And as Rakesh mentioned, I think it is important for all of us to be aware of what's happening, what's the current situation looks like, and how we can get back to some kind of post-COVID type situations. We're not out yet, but at least things are in a stage where the conversation to restart some of the crucial indicators of the economy, reopening businesses has been going on. So it is important for, from our perspective, to connect with you and to provide all of you with some of the information and address some of the questions that you may have. So I have prepared a quick slideshow. Some of the information may seem repeat if many of you are following our Facebook, but I just added there to provide a little bit of background and so that we can make the connection after that, how we are doing and what's the next steps looks like. So having said that, I will just start my slides. So very quickly, we know it's been almost 5 months now since we first identified the novel coronavirus back in December in a cluster investigation outbreak in Wuhan, China, which was later named as having a proper name of SARS-CoV-2, and the disease that is caused is called COVID-19. So majority of the case situation you may see just COVID-19. And the term can be synonymously indicated that it's the virus. So COVID-19 is not necessarily a virus. The actual virus is SARS-CoV-2, but the disease it causes COVID-19. But more commonly, everyone calls it COVID-19. So this novel coronavirus belongs to a group of viruses that share pretty much the same characteristic, and it can range all the way from common symptoms such as a common cold all the way to the more severe symptoms such as SARS, severe diseases such as SARS and now COVID-19 and MERS-CoV. So all these viruses belong to the same group of family and has been seen in the world time and time again. So just a quick background in terms of some of the science behind how these viruses infect others and what are some of the measures then according to the way these viruses move in the between people to people would help justify or maybe provide more information on some of the measures that are currently in place. So what we know is this particular virus cannot exist or cannot survive outside a human body. So it needs a human host to survive. So now we know that this virus is there and it needs to infect others in order to multiply and replicate itself and to find another host and then move on. So going through the chain of transmission, so once now the person is infected, now the virus is inside the body. What it needs to do, what it does is it continues to multiply, and then by the time the body either starts to fight infection and then get rid of the virus, and until the virus find a way to get out of the body and find another host, and that way the transmission continues from one person to another. When a person is actually sick with COVID-19 or having the virus that is causing COVID-19, when they're sick, the virus need to come out of the body. The virus tend to reside in the upper respiratory tract of our body, typically our throat and mostly the nasopharyngeal area, which is right behind our nose and throat. And that's why when we're talking about the nasopharyngeal swabs, that's where we get these specimens from. So the virus tend to reside there and tend to multiply there in large number. And the only way the virus can come out is either when a person is touching their hands, using their hands to touch their mouth or touch their nose. The other way it can come out is when someone is having a symptom such as coughing or sneezing, which would then bring that virus from those areas and push it further outside of the body in the form of droplets, because this virus needs, it cannot stay airborne, it cannot travel through air, so it needs some kind of a medium. And typically the medium is little tiny drops of water vapors that currently exist in our mucous membrane or in our nose and throat. And so it attaches itself to those water droplets, and then when a person is coughing or sneezing, or in some cases if they're really sick, when they're talking, it could come out in the form of attached to tiny droplets, and then can carry it further. So when it is attached itself to those tiny vapors, it cannot travel that far. And the most it travels could be up to 2 meters. That's why when we are talking about any kind of physical distancing measure, we need the 2 meters distance from one person to another, which could safely prevent these droplets to fall down on the ground. Even when someone is coughing or sneezing, it travels a little bit of distance and then it tends to drop down immediately. It may take a few seconds, up to maybe like 15 to 30 seconds max, and then it tends to drop down. And if someone is near that mark, either they are now directly exposed to these droplets, and that exposure could happen directly to their mouth and nose, where then the virus can get inside the body, or it can be transmitted in terms of another mode of transmissions, which could be any type of indirect agents. Most commonly, if someone is touching their hands, touching their eyes and nose, what they're doing is they're now having their hands now carry the virus. And if they're shaking hands, if they're coming close, if they're coughing and sneezing on each other, then the transmission is happening. When that transmission is happening, now the virus is on another person's body, it needs to find a portal of entry. So whoever is now exposed, they need to bring this virus inside their body by using their contaminated hands and touch their hands, touch their mouth and nose, or doing something which could introduce the virus inside their body. So then now the virus needs some kind of a portal of entry. Once the virus finds some kind of an entry into the body, it needs to find a susceptible host, because virus cannot survive outside of the body. Every person, because this is a novel virus, our body has never seen this virus before, so everyone is susceptible. Everyone in the community, that's why we are seeing all these transmission happening in the community. So anytime a virus gains access inside the body, everyone develops symptoms, and then they go on to the becoming a sick individual, becoming a reservoir, and then the cycle goes on and on. So that's how typically these viruses tend to spread in the community. So what happens from these type of public health measures, we try to break this chain of transmission at each and every step of this transmission. Ideally, in an ideal world, what we need to do is we need to get rid of this virus completely from the face of this world, which is very difficult to achieve given the time and given these viruses are very small and how widespread it is. That typically is the goal for all the public health measures to eradicate, but if that doesn't happen, then it continues to find a human reservoir, and then the cycle continues to go on. If we can eradicate it, we will no longer have any of these type of infection. The only disease that we have eradicated from this world is smallpox. That's why we don't need any vaccines or anything like that. And smallpox cases, we never see it. Another example, what we necessarily call as eradication, we call is elimination. So elimination is another step. What we say is in Canada, we have eliminated measles. So that means there is no transmission of measles happening inside Canada. Any of these cases of measles, they are typically imported from other countries, and then public health immediately kicks in, and we try to contain it so that it doesn't spread in the community the way what we are seeing with COVID-19. So those are the public health goals. Now, when we have the human reservoir, a person now is sick, the best thing that we can do is we need to do an early diagnosis and isolation. So the moment someone becomes sick, if we can diagnose that, if we can put some control measures in place and isolate that person, that means the virus will not find another viable host and then can just die inside the body when the body starts to fight infection, and that way it won't go further. But let's say if that fails, now the virus is to find a portal of exit. It needs to come out of the body. And in terms of the symptoms, these individuals need to have symptoms, or in some cases, pre-symptoms or mild symptoms, which may not necessarily become noticeable or obvious, and the person can still transmit the virus. But those are rare instances when these things happen. And when it does happen, we talk about infection prevention and control measures, which includes masking at the source. So if you have someone who is sick, if they're masking at that particular time, even though the virus is trying to get out of the body, but because of the mask, it will stay there. And that's the whole rationale behind when we're asking people to wear masks. It's not to protect yourself, it's to protect others from contracting the virus that may be coming out of the body. And then same idea, if we're wearing all the appropriate personal protection, protective equipment, such as wearing the mask, gloves, or anything else that is needed to reduce the number of viruses that are coming out of the human body, then we can do that. When we are talking about the mode of transmission and requiring the portal of entry from hand washing and alcohol rub, that's why we are saying that we need to do the hand washing more often, more frequently, to make sure that even if your hands are contaminated, you're not introducing the virus inside your body. And even if that fails, then the virus gets inside the body, and then the individuals, most of the time, because we don't have any natural immunity, we develop the disease. And if we get the vaccine, so even if someone is introducing the virus inside their body, the vaccine will prevent it from developing into a disease. And let's say even if that fails, then if we have a good antiviral treatment, once the person is infected, we can provide them with the treatment, and then that way we can contain the virus without affecting or without giving it the opportunity to multiply and infect others. So unfortunately, we don't have any antiviral treatment. We don't have any vaccine available at this point to treat. So all the focus is early diagnosis and treatment, ensuring that infection prevention and control measures are in place. And we are doing a good job in terms of hand washing, alcohol rub, putting in all those public health measures, such as maintaining the 2 meters distance and limiting the number of people that are gathering. So moving on to the next slide from what Ontario's response to COVID-19 is. So the government of Ontario has given their response divided their response into 3 phases. The first one was protect and support, which was the initial phase, when the focus was to ensure the well-being of individuals and family, and supporting the frontline healthcare workers, essential workers, and businesses, because we needed all these people to be in place to keep on with the life that we need. So we need food. We need to make sure that if people are getting sick, they are getting to their healthcare providers, and the healthcare providers are controlling the disease and preventing further spread of the transmission. And then through government assistance, there are a number of measures were put in place to protect people and their jobs by government subsidies and other type of incentives to keep them working, employed, or in some cases when they are not employed, to provide them with some kind of income support to help them. Then moving on to the next phase, which is the current phase that we are right now, which is called the restart. And in this particular phase, it's a stage-by-stage approach to loosen some of the emergency measures and reopen Ontario's economy. Even in this phase, the public health and workplace safety will continue to be the top priority, because we know that we haven't got rid of the virus yet. The virus still exists in the community, and it is still circulating in the community. So what we need to do is, if we really want to get back to some kind of a normalcy, is to make sure that we are continuing to follow these directions to keep the number of cases either at a very low level or to 0. Ideally, I would like to see 0, but recognizing that even if that's not possible, then what we need to do to ensure that these numbers are kept in check. So that's why some of these recommendations, even in this phase 2 start, is built on the principles of ensuring that most of these public health measures are continue to stay in place. So as Rakesh was mentioning that right now under the Emergency Management and Civil Protection Act, we have all of these restrictions in place up until June 9th. And what could happen after, we don't know. Maybe some of these closures will open and some of these closures will continue. We don't know that, but the expectation is some of these restrictions will be closed. And I'm sure you have gone through some of these lists and aware of it, but if not, then please visit our website to see the complete list of closures that exist in Windsor and Essex and through the Government of Ontario website. Moving on to some of the numbers that we are seeing. So this is again nothing new that I'm presenting. This is the information that I presented last Friday in our EPI summary update, and I'll provide another EPI summary update tomorrow. And so what this particular graph shows is the 3-day moving average of the cases that we are seeing in the community. And as we can see, in mid-March up until mid-April, we have seen number of cases touching close to between 15 and 20 cases a day, and then dropping down to less than 10 cases in the second and third week of April, and continue to show the downward trend that we are seeing right now. And if you recall a few days since the last 3 days ago, we had a couple of spikes in the number of cases in one particular industry. Other than that, we are moving in the right direction. We still haven't achieved 0 case a day, but we are moving in the right direction, and we are hoping that all these measures, if people continue to follow, we should be able to see those numbers. How we compare with respect to our numbers in a standardized way, with and recognizing that all these big places have more people, more densely populated community. And if you're looking at it, we are not doing that well compared to the provincial average. So provincial average is, you can say, 163 cases per 100,000 population, and we are at 189 cases per 100,000 population. So definitely we are above the provincial average, and we are right above, right close to the margin of some of the bigger places such as Toronto and Peel. So this is something that we'll have to continue to monitor and see how it will impact us in the long run. Another interesting slide that I would like to share is the distribution of these cases by municipality. No surprises there. Most of the cases is in Windsor, but we are seeing spikes in Leamington, Kingsville, and mostly in Kingsville because of the long-term care home, and in Leamington, mostly by migrant farm or the agricultural farm workers. We may see a significant increase probably tomorrow, because we had a spike in the cases in this particular industry. So our tomorrow's update will have some of the additional information for you. So this particular graph basically shows the exposure history in terms of what is happening in the community. Are these cases happening as a result of a travel? Are these cases happening because people are going out in the community and maybe potentially exposing themselves to other cases without even knowing that there is a case, which we call as community transmission? And then the last, if these cases are already identified and are self-isolating, which we call as close contact. So clearly we can see that most of these cases, at least in the last few days or few weeks, were in close contacts with very limited community transmission. So which is a good sign. If we are able to reduce the number of community transmission, that means the system is working. We are able to identify all the cases and are acting immediately to control it from further spread. Moving along, then in addition to these number of cases, what we look at is the hospitalization rates, ICU rates, and how this is looking. So overall, if we can see, we have seen relatively stable number of cases across a long period of time at the hospitalization. We saw a big decline in number of hospitalized cases around May, but then we are seeing an increase in as we move forward. Similarly, from an ICU perspective, we saw more cases in ICU, but now those numbers are going down as well, up to a level which is pretty much like flattening the curve that we are talking about, that we are not seeing that many cases in the ICU, which is a good sign for the community. Again, in terms of the case fatality, how many people are dying? If we are looking ourselves and comparing it ourselves with the Ontario, overall case counts and overall cases in the long-term care home and the community setting is less than the province of Ontario, which is again something that is a good sign. Overall, Ontario has seen 8.2% case fatality rate, and in our region we have seen it 7.6%. With a significant number of cases or deaths happening in the long-term care home compared to the community cases. So this particular graph shows the case doubling rate, which is a day-over-day comparison. And it basically, it shows if you have a case doubling time, which is less, that means there are more infections spreading in the community. And if you have a case doubling time, which is high, that means the cases are spreading slowly in the community. So just another measure that we use. And then you have a mean R naught effective, which is basically is if you have a case, how many people this particular individual will create new cases. So in epidemiological terms, what we say is if you have an R naught of more than 1, that means the cases are continuing to spread in the community. If you have an R naught of less than 1, that means we are seeing a decline in the number of cases in the community, and eventually we'll get to the point when we don't have any new cases. But looking at the graph, we have seen some ups and downs in the number of, in terms of calculating the mean R naught. But mind you, this R naught is based on the measures that are currently in place. If you remove those measures, the R naught number could be very different, depending on the looser restriction and what it would mean for the community. So when we'll finish our phase 2, the last phase would be to recover. So which would essentially means that we have found a vaccine or we have no longer are having cases, and then how we can get back to our life, our new normal. What does it look like, and what it means for some businesses, whether we'll continue to do have all these restrictions in place, or we will be focusing more on identifying new opportunities across the province. So in summary, what we can say is the case counts are continuing to show a declining trend with some day-to-day fluctuation. Our case counts is higher compared to many places in the province. And most of the cases in Windsor and Essex have been resolved, but there are still cases that exist in the community. The outside of the long-term care home and retirement home, the most significantly hit industry is the agricultural industry in Windsor and Essex. And we are continuing to work with them to provide them with the guidance and support that they need to prevent and reduce the number of cases in that industry. So I'll stop here and I'll pass it on back to Rakesh for further discussion.
Thank you, Dr. Wajid. That was a very detailed presentation and a lot of wonderful information you've shared. So thank you for that. And I'm glad to see that, our trend is positive. Though there are new infections, at least, the fatalities number has been very stable and it's not increasing. So it's good to see that. Again, thanks for the efforts of you, the entire team. And we are all looking forward to the time when we will get into the recovery phase, but there's still time for that. This is the time for us to focus on reopening, and very important for us to reopen wisely and take the right steps. So we're going to be talking a bit about what the businesses can expect in terms of support. There is a toolkit that your organization is releasing, and that is a guideline and advice for businesses. I think this will be something which will be very important. And as part of that, there will be checklists as well for different sectors that will be also made available. So to provide us more information, we have Nicole Dupuis, who's the Director for Health Promotion at the WERCC, and I'll request her to walk us through the toolkit and the information there. Over to you, Nicole.
Okay, thank you. I'm just gonna share my screen. Okay. So I just want to acknowledge there is Phil Wong and Neil Mackenzie are both panelists on this, and I was lucky enough to present their work. So I just want to note that. And I'll try to be quick because I know there's limited time, and question and answers I think are an important part of this presentation. So quickly, I'll just provide a bit of a background for the toolkit and where we're at, rationale, briefly go over our toolkit content and some of the resources, signage that we've prepared, as well as identify our next steps. So just a bit of background, and Dr. Ahmed already discussed some of this. At the end of April, Ontario released their framework for reopening. And then May 14th released their stage 1 part of that framework, so their staged approach for reopening businesses and the economy. And that started, of course, with golf courses, marinas, and a few other businesses. The province also at that time launched sector specific guidelines. I think there's about over 90 of them, and as well as a couple different websites that are dedicated to supporting businesses. As well, the WERCC has engaged since the beginning, actually, with BIAs and local chambers in discussion first when we were talking about closures of businesses, and now, of course, as we're talking about opening businesses. And we look forward to continuing that partnership and engagement as we go, and are grateful for the advice that they've provided us. And just kind of noted that our commitment, the Windsor-Essex Health Unit, since really the beginning of COVID, our commitment has been to provide up-to-date, relevant, and credible resources and information, and be responsive to as responsive to our community as we can be. So that's really been our sort of focus on communication. So why a toolkit and why a local toolkit? So as I mentioned, there's over 90 guidance documents. Many associations as well have provided guidance, including sector-specific guidance. But what we really heard was there was a need for a simple sort of resource, a one-stop shop for information. And this is something not unique to businesses, but we've seen and heard from our community in a number of factors that they really want one place to bring all the information together to make it easy for them to navigate through this world, with COVID. Through this consultation, we identified some of our first steps. So again, thankfully to folks like WERCC and our BIA partners, we talked about what can we do first to get started, and then what will we continue to do as we go forward. And we really also talked about the need for tailoring advice and providing local relevant tools. So while there are many resources out there, Health Canada's put out resources, many folks will go to the World Health Organization or CDC, but synthesizing that information and bringing it to the community in a really simple way that explains the basics. And that was really, has been our focus and is the focus of the toolkit. Okay, so I just put this in here. This comes from the province of Ontario. It's just a good guide for sort of how they're moving through things and their key principles for reopening. So some of the basic measures you'll see reflected in the information we're providing, as well as in the toolkit, really does align with these key principles. Staying home if you're sick, which includes screening, the physical distancing, sanitizing, hand washing, masking where needed, etc. The toolkit content has 6 general sections for businesses and workplaces. Sorry, just looking at my notes. So first is assessing the risk for employees and customers. So as you're considering reopening, or if you're already open and you're looking at sort of your long-term plans, these are important steps for you. Reducing the risk of spread. So really having a plan on how you will reduce the risk of spread and exposure within your workplace, policies that you'll need to have in place, creating a communication plan for staff training and customer training or client training, how you'll monitor risk within your workplace over time and how you'll be responsive to that, and additional considerations. So that's generally the content that's addressed in the toolkit. Okay, so assessing the risk for employees and customers. Important elements to consider when preparing to reopen are planning. So really, you need to go through every step of your workplace. So every process, every task within the workplace needs to be reviewed and really needs to be mapped out. And you can use that map to then identify areas that need to be modified and start to work through a plan around, you know, what can be put in place to make changes to make your environment safer and healthier for everyone. Policies and practices, as I mentioned, looking at the demographics of your workforce, customers and clients need to be part of that risk assessment. So what population do you serve? Is it a senior population or another population that may be at increased risk for COVID? And how will you address their needs and ensure that their protection, as well as addressing environmental cleaning and occupational health and safety. So again, these elements of assessment, of risk assessment, really align with the principles of reopening. Some of the key questions to ask when looking at assessing the risk for your employees and customers. And again, I just want to acknowledge that the toolkit is meant to be a guide. It's not per se going to duplicate some of the guidance that's out there by the province or give exact direction about every aspect of your business, but really is meant to guide the questions you should be asking. So key questions would be, does your workplace or business already have a plan? It's time, if it does, it's time to probably pick it up and review it. Can your workplace or business support flexible work policies and staggered arrangements? So this is really critical in considering how many individuals need to be in the workplace and how many don't. And this is important, of course, as you're bringing people together, you're increasing risk. So if there isn't a need to bring folks together within a building, then that's the best model to move forward with. Do you know if your employees who's at greatest risk and how you handle that? So some of what I've said before. And how easily can your business sort of model be altered or modified to address public health and infection prevention and control? So for example, hand cleaning stations, what will that look like, et cetera. And also reviewing your environmental cleaning protocols and procedures. So these are all things that you need to map out, things that you should have, and elements of your business that you need to review. So reduce the risk of spread. We like this hierarchy of controls that we've put in the toolkit, and it really, I know there's a lot, we know there's a lot of focus on personal protective equipment and PPE, but as you can see, that's actually at the bottom. And really it's through sort of the elimination or the mitigation of risk. So eliminating exposure altogether, thinking about substitutions. So, you know, doing video-based or delivery over an in-person service would be considered a substitution and would be a much safer practice. Engineering controls, so those are actual physical changes to your environment, to distance people and moving things around within your business to navigate flow of individuals within your workplace. And then administrative controls, which would be the policies in place to sort of manage everything. And then PPE would be sort of the last step that you might consider. So if you cannot maintain that 2 meters of distance, then, you know, the recommendation would be for PPE, and depending on the type of service you're providing, there's various recommendations for the types of PPE that would be needed and required. And those are important to be reviewed by all workplaces. And I know the health unit has mentioned many times that that's an important measure to make sure that we're conserving and using personal protective equipment responsibly. So the other part of the toolkit would be having your policies in place. So you'll see the picture there. The two key pieces, of course, is screening is a really important aspect of your plan as you move forward, and also an important policy. So really all staff should be required to either complete the self-assessment prior to coming into work. And then you may also put policies in place to have an active screening model when people arrive, whereby a supervisor or someone will run through all of the questions that are in the screening tool with employees when they're on site. And of course, the direction would be for those who screen positive that they would stay home if they were sick and contact their healthcare provider for follow-up. So that falls in the how to report an illness. So standardizing your procedures for reporting illnesses, making sure that people have time that they need to stay home, or if there's arrangements that can be made to make it easier for everyone. And then reviewing your health and safety policies and building sanitation practices. So again, I mentioned this before, but infection prevention and control practices and cleaning practices. So reviewing all those policies. If you don't currently have policies around that, now's the time to develop them, and then make sure that you have everything that you need in place, and you're reviewing it against those checklists or against public health guidance to make sure that what's in your policies, will be effective and meet requirements. The next step the toolkit addresses is creating communication plans and staff training. So as many businesses know, or we all know, and certainly for us in public health and health education, it's one thing to create policies, it's another for them to be followed, and a communication and training is a big part of that. So it's important to come up with a plan. How will you train your staff on the new way of working, and then if you are outward facing, how will you ensure that your customers understand the rules and the requirements of engaging with your business, and how will you communicate that going forward? So making sure that you have all of those plans in place, and in particular thinking about your client population. Is there any sort of language barriers that need to be considered or addressed, or cultural barriers that need to be considered and addressed as well, to make sure that everybody has the same access and will be able to comply with what you need them to. And I apologize if I'm speed talking. I'm trying to move quickly through this. Okay. For some reason, my screen is frozen. There we go. Okay, so monitoring risks. So as new information becomes available and our situation continues to change, so making sure that business owners are staying on top of up to date on the information and most current guidelines, making sure that you're adjusting your policies. You may want to assign this to your local, your workplace health and safety committee, so that somebody is always up to date on what's new and relevant and what needs to be adjusted as well. We hope that we're a good resource for that. And we are committed to continuing to provide information. And if information isn't easy to find, we're definitely open to feedback. And we'll work with our BAAs and chambers as well to collect feedback and be responsive to needs and get communication out to businesses as they need to modify and change. Just some additional considerations that are part of the toolkit, or really part of the guide, is just recognizing the uniqueness of each business. So it was mentioned, I think, in the very beginning by Rakesh around staff turnover and absenteeism. So it kind of goes back to the planning pieces, but really addressing that and thinking about that in your initial plans. So it's likely expected that you may have trouble recruiting people. Staff absenteeism is always something that needs to be planned for, but we may have an increase in absenteeism right now. So, and then how will you function and operate in those circumstances, and making sure that you still have enough staff to ensure the safety and quality of your service. And again, the time and resources for training. So before you open, making sure that you have the time in place to train all of your staff, to make sure that they're comfortable to come back and that they're going to be able to uphold the practices and the policies that you've put in place to ensure the safety of everyone in your workplace, as well as everyone who might be coming into your business. So just some supplementary resources, things that we will hopefully be adding to our website. So we are talking a bit about the toolkit, which is a PDF document. It is very simple and meant to be just a basic guide. And the intent to that was because things change so rapidly. We didn't want to update the toolkit, every day. However, our website, we hope to add to and update daily. So, and these are some of the items that we will be adding to our website as we go on. And again, if there's information that's needed or missing, we'll have a forum for providing that feedback and move forward with adding it. So some planning documents are already out there. We are looking to online courses, and some associations already have online courses available for sector-specific courses. We'll be looking to provide some webinars locally as well on relevant, pertinent topics to businesses. As well, discussing guidelines and best practices. So breaking down some of those best practices and guidelines, some of the things we've touched on now, into short modules and webinars that we can share going forward, such as cleaning and disinfecting. The checklists were already mentioned by Rakesh at the beginning. So having just basic checklists for every business. So that is something that we will be providing. Some of the initial items that we've done so far. And again, just keep in mind that this has really just been the past few weeks that we've started to put some of these things together. So I'm recognizing that even for our own agency, there's a need to make sure that we have good communication about the rules. Signage, of course, is a big part of that. So we have developed some of the signs that you see here on the slide. So stand here, and we will be printing some of these as decals and stickers, and we'll happily provide them to businesses at their request. And then obviously we will happily provide these resources on our website, and you can print them. We have translated them as well into multiple languages. So French, of course, we have translated them into Arabic and Spanish, and I think a few others, and they'll all be linked on our website under our workplace page as well. So just some key signs, identifying a tent card, this area has been cleaned, so that, for example, in an office setting, you can put that on an area and folks know that the surface that they're going to has already been cleaned, or if they've cleaned it, being able to put that sign back on. Visual signs for where to stand to make sure that the spacing is appropriate and everybody knows what they're supposed to do. Talking about sanitation, so sanitizing hands before and entering the building, or if you have a large business, using those signs at multiple points throughout your business. We also have a sign for checking your for self-assessment, so making sure that just even a reminder for employees when they enter to not forget to do the screening tools. For some businesses, they have required masks to be worn, and in some guidance documents from the province, this is required. So signs reminding people to wear a mask. And if you are a business that requires mask wearing, if someone doesn't have one, making sure you have provisions to provide it. This is just a quick visual of some of the checklist memos and guides. So there'll be more to come. This one here is actually, still says proof on it because it just was completed today. And some of the things that we have been doing since the beginning, an example there, a public health memo that we created, recommendations for public transit. So those will all be available. They are already available on our website, and we'll continue to add to those as we go on. And there's a quick link to our website there. I won't click on it just for the purposes of time. So our next steps are just to promote and disseminate the toolkit, as well as highlight the new section of our website, which really will have a lot more than the toolkit itself. Continue to develop and release the checklist as as different businesses are announced to be open. And the hope is to complement what the government has already put in place. And again, as I said, we'll continue to update our website, engage our partners on a regular basis, and provide more educational resources and virtual content going forward. And that's it.
Thanks, Nicole. That was very informative. And as you pointed out, that this is a high-level document. The toolkit will be available on your website. It'll be also available on the Chamber's website, and the other resources that are part of the toolkit, including checklists and the other resources, will be available on the community health units, county health units website, as well as the Chamber website. So please feel free to download information from there. There's already some information related to the presentation that you just made, and the question that we got is that, is it possible for us to share your presentation with the attendees here today, so that they can use it for their internal training purpose? Are you okay with that if you were to share your presentation?
Yeah, absolutely.
Okay. All right, great stuff. And as you rightly pointed out, that there are checklists that are now being available. So I know there's 2 checklists that is right now available on your website. It's on food premises, meaning restaurants and bars, and there's also for gyms and studios. So those checklists are available for anyone to use them. Download it from the health unit's website or from the Chamber's website. So we'll take some questions now, and before I do that, I would like to invite the entire management team of the health unit. As I mentioned, this is a fantastic team that has been led by Theresa. We've got Theresa here with us herself, Dr. Wajid, Ahmed, Kristy, McBeth, who's the Director of Health Protection, Nicole, whom you just heard, Phil Wong, who's the Manager of Environmental Health, and Neil Mackenzie, who's the Manager of Chronic Disease and Injury. So I would request everyone to come online. I see everyone. Yeah, Theresa, you're there. Okay. So thank you for making time and for being here so that you can help us with the questions. We've had a lot of questions that were sent to us before the webinar started, and this was from a lot of our members and from the business community. So we will take some of those questions. I do appreciate everyone that has sent the questions and has sent some questions via chat and the QA portal here as well. We're hoping to get to all of that, but in the event we don't get to all the questions because of time constraints, we will make sure that we pass on your questions to the health unit, to Theresa and her team, and we'll get the response back from them, and then we'll update everyone. We are posting those responses on our website. So let me get started with some of the questions. I think the first one was to do with what kind of businesses are allowed to open. I think there's information on that Nicole, you covered, and plus also on the website. The other question we had was to do with what does one do if an employee tests positive and has been in contact with someone who has tested positive for COVID-19. So who would like to take this?
So I'll start, and I'm sure others may add if needed. But basically what happens is every time we are getting a positive case reported to us, our team of nurses immediately start the case and contact management. And what we do is we identify high-risk contacts, medium-risk contacts, and low-risk contacts. And based on that, all the high-risk contacts, which has basically is exposed to the case with a strong likelihood of contracting the disease, we ask them to self-isolate for 14 days. And those who are a medium-risk contact, we ask them to monitor their symptoms. And those who are identified as low-risk contacts, they don't need to do anything different than what they normally would do. But recognizing this is a different time now, and if the people are coming to the business, they already are being asked to monitor their symptoms and do the active or passive screening before they enter the workplace. So having those measures will definitely help, but it won't be a clear, straightforward answer that anyone who has come in contact with, whether they should be self-isolating or not. Our team provide that information. Some of the guidelines, high-level guidelines, are available on our website too. But generally speaking, it's the team, when we are interviewing the case, we come up with the answer.
Okay. So in the case of the employer, what is the employer's obligation or responsibility if they find out that there is an employee that has tested positive? What is expected of the employer?
So I think it really depends on the couple of things. One thing to note for sure is the privacy piece. And if, let's say, if we don't have the permission from the employee to report that to the employer, we do not share that. We encourage employee to share that and have that discussion with their employer or their occupational health and safety people. From our investigation perspective, what we do is we collect all that information, and then we reach out to the individual who worked there at the facility or the company. And then if needed, if we need, let's say, more information. So for example, the employee was sitting in a meeting with a number of people that we may or may not have any information. So in that case, we reached out directly to the employer without even disclosing that who this person is. We ask information, okay, who was present at that time and the list of all those people, and then we reach out to them. From an employer perspective, obviously, if they are aware that there is a risk, we provide them with the recommendation that what they need to do in terms of providing us with the information, and then ensuring that they have processes in place to protect other employees from contracting the disease in the first place, and take appropriate precautions based on our recommendations to ensure the safety and well-being of the facility.
Okay, thanks. And this question is, do I have the right to require my employees to provide medical documentation to show that they are not sick?
I don't think that this is there is any legal obligation to ask or request that. I see it as more of an organizational policy, which can be challenged, but cannot say that they can legally ask and the employee must have to provide that. That's not the case to my understanding.
Mm-hmm. But in the event there is an employee that shows symptoms, is it okay for the employer to get, maybe the temperature checked and things like that, so that, the employer can verify whether or not the employee is sick?
So I think you have to go back to the occupational health and safety policies of each of the organization. And based on that, I think it's a fair concern that if someone who is identifying that they are symptomatic or if they need some kind of a support, based on the occupational health and safety policy, you may want to send this person home because that's the most important thing that you want to do, especially in COVID time. Anyone who's symptomatic, they shouldn't be at work. And you may ask that individual to go home, wait until they're symptom free, or have a note from the physician without requesting all the information or personal health information, can get a sense that whether this employee is fit to come back to work or not.
Mm-hmm. Thank you. And what obligation do employers have to inform customers or clients in the event there is an employee that tests positive? Do they have to, to go back to everyone that they have done business with in the time duration that they found out? And do they have to inform? Is there a formal way to do that, or what's the process, if at all information needs to be passed on to customers and clients?
So I'll start, and I don't know if anyone else wants to add, but basically what I see is, again, going back to the same idea of privacy and ensuring that we are not jeopardizing anyone's privacy by sharing this detail of personal health information with people who don't need to know. From a business perspective, what you can say is anyone who was in that particular business place or between this and this time, when you're expecting that employee came in contact with others, you may identify that specific timeline and then the specific location that where the exposure could have happened. And based on that information, you can share that information. Other than that, I think if there is a high risk situation which requires more public disclosure, then health unit typically takes a lead on it and do that disclosure at a broader level. But at an individual level, after the case and contact management, if there's any business related issues, that information can be shared without disclosing any personal information.
Okay, thank you. Next question is, does a business owner have the right to remove someone from their establishment who's not following public health recommendations?
Uh,
If someone comes in and is not following the guidelines, is not complying, can the business owner go to that individual and say, you have to leave?
Well, I guess I'm not a lawyer, but I think that it's a private establishment. The business can set up their own rules, that what rules they want their patrons to follow. There is always a concern about a human rights issue, that someone can challenge you, whatever policies that you are, if it's infringing basic human rights, they can challenge you on that. But to my understanding, a business establishment can set up rules and make sure that they are providing that rule well in advance, and then people can choose to either attend that business or not to attend that business. I don't know, Neil, Phil, anyone else, if they want to add anything. So hearing none, so I think my answer is good enough.
All right, good. And this is to do with pharmacies and clinics, so those operations which are considered to be more at risk, so to say. So for those businesses like pharmacies and medical clinics, are there any extra precautions that need to be taken?
No, I think going back to the broader guidelines, I think that's what it's recommended. And the best, like for healthcare place situation where you may expect to see someone who is actually symptomatic or who actually may have COVID, you can provide them with a mask, and you can do that some kind of a screening to ensure that if they meet that criteria, then the organization or the establishment have to have a policy, then what's next. So if someone is going to the Shoppers and they have other upper respiratory symptoms and they're looking for some cough and cold medication, and if the Shoppers wants to provide, serve this client, what does it look like? Would they ask this person to wear a mask and then go in and pick up the stuff? Or they will say, nope, don't come in because you're symptomatic, tell us what you need, and maybe have a curbside delivery or something else. So I think they can do that, but right now there is no specific requirements that they have to do it. The healthcare providers are also have like some guidelines that they follow. I'm not particularly aware of any specific sector-specific requirements for like pharmacies and other stores.
Mm-hmm. And this question is about day camps. Day camps are not yet allowed to open as of yet, to my knowledge. But are there any specific regulations that apply to day camps, and how many children will be allowed in the day camps whenever they open? And will children have to wear masks as well? So are they all related to day camp and children?
Yeah, so we haven't received any formal guidelines from the ministry that what it looks like, but recognizing that most of these day camps starts in July. So we're hoping that we will hear more details from the ministry. From our perspective, if it's our decision, then we'll have to obviously look at going back to the same public health principles in terms of limiting the number of people that are attending the camp, what kind of activities that are happening, how they would ensure the physical distancing with these type of activities, and if any of these activities would involve any direct physical contact or not. So we'll have to review the plan that how these day camps would be offering their services to the community, and then we can make a recommendation to make it safe, but also meeting the Emergency Management and Civil Protection Act. Under the Act right now, these, as you said, these camps are not allowed. Gathering of more than 5 people are not allowed except for exceptional circumstances. And until that changed, we obviously do not expect that there would be any support to run these camps.
Mm-hmm. Thank you. And yes, we're running over, but there's few, I would say, interesting and relevant questions. So I'll go through them quickly. This is on hand sanitizer. Does it become ineffective if one uses it many times? And if one is not washing hands, but using hand sanitizer more often, does it become ineffective?
Short answer, no. I'll let Phil answer because he's our infection prevention control person. So I would let him answer.
Hi guys, it's Phil here. When you're using hand sanitizer, I think the one thing that folks need to do is make sure that it's being used at the appropriate time. You don't really want to use you don't really want to overuse hand sanitizer. It's not because it loses its effectiveness, but mainly so that it actually affects your skin. You might get drying, cracking of your skin, and then when there's more layers, more damage of your hands, it actually might promote more transmission of viruses and all that. So use the hand sanitizer when you need to use the hand sanitizer. Washing your hands with soap and water is also as effective.
Okay, thank you. Sorry, was there anyone else? Yeah. And this is about cloth masks. I think they're looking for guidance on what should be done with cloth mask. You know, if when one is eating, should it be removed? Should it be kept aside? Should be put in envelopes? What do you do with cloth masks? As more and more people will go to restaurants and other places with masks on, how do you handle that when you're in that environment?
So I'll start, and there are a lot of guidance available on our website on the proper use of the mask. So I would encourage everyone to go to our website to find that information in the interest of time. But generally speaking, the mask, especially in this type of hot and humid weather, I would request individuals to wear masks only when the physical distancing is not maintained, and avoid the risk of getting low oxygen or fainting in some cases that we have seen with especially with the cloth mask, because all these cloth masks, depending on the type of material, could reduce the air intake in every individual.
Mm-hmm. Thank you. A couple of questions related to travel. What if business requires an employee to travel? Can they travel now? Can they make some trips? And also about interprovincial trip, because some provinces have banned interprovincial trips, and some have kept it open. So what's the guideline on that? Question is, can I allow my employees to travel for work? And if they are going out of the province, do they have to self-isolate when they come back?
So international travel is limited, and knowing we are a border town, so I think this question is very relevant for us. International travel, other than the essential workers, which is like healthcare workers or other workers, they are allowed to travel without the need for quarantining. The interprovincial travel is obviously, it's not something that we would encourage, but recognizing that there may be reasons for those type of travel. There is no provincial regulations at this stage to say that people have to quarantine if they're going out of the province. So there is no regulations or requirements at this stage. But I think from a best practice perspective, we really have to look carefully in where this individual is going, what kind of risk that they may be exposed to, and if it would be in the best interest of your employee to travel and potentially expose themselves to the risk, to virus, and then potentially bringing it back and exposing others. The best recommendation would be to avoid all non-essential trips. But if they do, it needs to be done in a very safe manner, ensuring that they're wearing the PPEs appropriately, masks, and taking all the precautions, and basically avoiding coming in contact with as little, less number of people as possible.
Thank you. And this question is about allowing people to gather in a workplace. As of now, there's a regulation that you cannot have more than 5 people. But what happens when business is open? What is that then? What does that do to that restriction? How many people will be allowed in that kind of environment?
So I think we have to go back to some of the public gathering requirement, and then the business establishment requirements is different. I haven't seen anything specific in terms of within a retail store, how many people can be at one time. There is some broad guidelines that you will do the square footage of that particular establishment, and then you try to at least find a 4 square meter distance per person, and then make that calculation to come up with how many people can be in that particular establishment. So those are like rough guidelines that I'm aware of, and we'll see when more businesses are opening up. There may be some specific requirements from the province, but I'm not entirely aware of anything specific. Phil, do you have any specific guidelines?
In terms of square footage, it's what you mentioned, Dr. Ahmed. It's 4 square meters, and right now the only thing that they have the guidelines out for is stage 1 is for retail. So that's kind of what you wanna go by until further guidance is provided from the province.
Okay, thank you. This question, and you know, I know we're over, but these are very relevant question for the businesses. So please allow me to ask a few more. This one is about a business that has an employee that does not comply even with repeated coaching and and the counseling. What do you do in such a case where the employee just doesn't fall in line and does not comply with the requirements? Can they be written up? Can they be sent home? What is the possibilities here?
Sorry, can you repeat the question again? I apologize.
Yeah, no issues. This is about an employee that, in spite of counseling, in spite of proper training, and in spite of good practices, information on those, does not comply with those good practices, and is risking the lives of the others, the health of the other staff. What do you do with such an employee? Can you write that employee up? Can you send the employee home? What can be the recourse in the event that there's an employee that doesn't want to comply?
I can maybe get some help from my colleagues too, but I would say that your occupational health and safety policies should address that in case if you have an infectious disease, not only just for COVID, but let's say TB or measles or any other type of disease, which there is a risk for potential exposure to other employees. What are the policies there? And then I'll just rely on the policies, including any disciplinary action that you might think of based on those policies. But I would try to hang on to the policies first and ensuring that everyone is aware of the policies.
Okay, good. And I think the second last one, what would be your recommendation on the use of client interview rooms when other forms of contact cannot be used? What is the best practice for reusing the room? How quickly can we use the room after cleaning and disinfecting? So this could be, a clinic set, kind of a setup, or maybe even a hotel, motel rooms.
So I'll defer this question to our Phil Wong. He is the expert here, so he can answer.
Hi, Phil here. So in terms of cleaning and disinfection, general cleaning disinfection chemicals are appropriate. Anything with a DIN, you can use that. I mean, I believe what was the question? Cleaning of hotel rooms?
Yeah, it could be hotel or a clinic, a medical clinic.
Sure. Yeah. So anytime between, so if a person is leaving a hotel room, the general guidance right now is to wait 3 hours before going in. And the PPE that would be required would be just whatever the manufacturer's instructions are for the cleaning chemical that you are using. Additionally, we actually have a hotel and motel guidance document that's already developed on our website. I actually shared it on the Q&A chat box there, and you folks can take a look at it as well. A lot of great information on there. Thank you.
We do have a few more, but I'm just going to take one last one, and this is to do with air circulation. So as as the weather's become nice and warm now, people are starting their ACs on. Is it safe to turn on the AC? Is there an issue or concern?
I'll again defer it to Phil. Short answer is no, there's not a concern. I think there are good evidence to suggest that many of these HEPA filters clear that, but I'll let Phil to respond.
Yeah, sure. So it's actually good practice to right now have good air circulation and open windows when you can. It really has to depend on the type of industry that you work on those. So make sure that if you have open windows and all that, that you are following the regulations and the legislation that applies to your business. I mean, for example, if you are a restaurant, your windows must have screens. It's just for pest control and all that. So if you want to open the windows, it's great. Using an AC unit, HVAC unit, that's fine as well. As Dr. Ahmed mentioned, COVID is spread through droplets. They're fairly heavy, so you don't go that far. One thing to do, to consider, which would be good practice, is changing your filter. There's many different, if you're using HVAC, it's measured and it's the MERV filter that you're using, and it depends on how much filtration you want. MERV 13 filter will get rid of viruses, but it will reduce the amount of airflow, so you might be using a little bit more electricity or whatnot, but it will get rid of viruses. But like mentioned earlier, it is droplet spread. So, I mean, it's not something to be really concerned about at this point in time.
Okay, thank you. Thanks for that clarification. So with that, we will have to leave it here. There are still a lot of questions that we haven't yet got to, but what we'll do is we'll take those questions and then we'll send it your way, Theresa and Dr. Wajid, Ahmed. And once we get the response back from you, we'll give it back to the attendees and put it on our website as well. So I do want to sincerely thank all of you, Theresa, Dr. Wajid, Ahmed, Nicole, Neil, Phil. All of you have been great. Even before the event, it's been fantastic to work with you as we develop this checklist. So thank you for all the collaborative work that you're doing, not just with our organization, but with several other organizations in the region. I wish you all the best. You're doing a fantastic and a very important job in the region. So more power to you. And I hope that our community pays heed to the advice that is coming out from your organizations, and that we take all the measures that are required so that we can reopen safely. We at the Chamber will continue with our workshops, with our webinars. There is 3 that are lined up, really important ones and very relevant topic. Thursday, June 4th, we are doing Maximize Your Membership. Here you can learn about, if you're a member of the Chamber, what you can do to maximize the benefit, what you can do to bring more business to you, how you can work with the Chamber. We've got the affinity partners, member-to-member deals. There are things that you may not be knowing about the Chamber and the benefit it provides, which can help you and your business. So through this, we intend to provide you more information on that. Then on June the 9th, we have Barter Pay, which is an affinity partner that we'll be providing more information on. Again, this company and its services will be very useful to businesses in our region. It's a company that's doing business throughout Canada and outside as well. And then on the 10th, another very important webinar, we will be inviting Minister Vic Fedeli from the province, who's the Minister for Economic Development. And he will be coming to share about what's happening in the province, what measures are being taken, and what resources will be available to support businesses. So those are the 3 upcoming webinars. Please mark your calendar, and you will have this information come to you through various channels. It will be also on our website. With that, I thank everyone for being here, and I apologize for the extra time we took today, but it was a very important topic and very important webinar, and we were thankful to the community, County Health Unit, for making time for this. So once again, thanks everyone. Stay safe, and we'll see you soon. Take care.